CPR is used when someone's heartbeat or breathing has ceased. Begin CPR with chest compressions. If you are untrained, do not try rescue breathing. Instead, do chest compressions at a rate of 100 to 120 beats per minute until help arrives. If you are trained but rusty, just do chest compressions at 100 to 120 beats per minute. If you are trained and confident, check to see if there is a pulse and breathing. If there is no breathing and/or a pulse, start chest compressions. Do CPR with 30 compressions and then give 2 rescue breaths. Before starting CPR, some things to consider. Is the environment safe for both you and the person? Is the person conscious or unconscious? If the person appears to be unconscious, gently shake the person and ask loudly, "Are you okay?" and repeat 2 to 3 times loudly enough that they can hear you. If the person doesn't respond and other people are available, have someone call 911 and if possible, have another run to get an AED. If you're alone, call 911 before starting CPR. Get the AED if possible. When the AED is available, deliver 1 shock if instructed by the device, then begin CPR. Spelling CAB. The American Heart Association tends to use the letters CAB for chest compressions, airway, and breathing. This helps people remember the order to perform the steps of CPR. Compressions should be performed to encourage blood circulation. The airway should be opened, and breathe to restore air into the body. This is known as rescue breathing. C for chest compressions. Step 1. Put the person on their back on a firm surface away from dangers. Step 2. Kneel next to the person's shoulders and neck. Step 3. Place the heel of one hand over the center of the person's chest, between the nipples. Place the other hand on top of the first hand. Keep the elbows straight and position the shoulders directly above your hands. Step 4. Use your upper body weight, not just your arms, to push straight down on the chest at least 2 inches, but not greater than 2.4 inches. Push hard for a rate of 100 to 100 chest compressions per minute. If not trained in CPR, continue these compressions until there are signs of some movement or medical personnel arrives. If you are trained in CPR, go on to opening the airway and start rescue breathing. A for airway. If you are trained and confident in CPR, you can perform this step. This step will open up the airway, making it easier for the person to breathe. Once 30 compressions have been performed, open the person's airway. This means using the head tilt chin lift maneuver or jaw thrust maneuver. B for breathing. Rescue breathing can be mouth-to-mouth or mouth-to-nose breathing if the mouth is seriously injured or can't be opened. Step 1. With the airway now open, pinch the nostrils shut for mouth-to-mouth breathing and cover the person's mouth with yours, making a sort of seal. Step 2. Prepare to give 2 rescue breaths. For the first rescue breath, lasting 1 second, watch to see if the chest rises. If it does rise, you can give the second breath. If the chest doesn't rise, repeat the head tilt chin lift maneuver or jaw thrust maneuver and then give the second breath. Step 3. 30 compressions followed by 2 rescue breaths is considered 1 cycle. Be careful not to give too many breaths or to breathe with too much force. Step 4. Resume chest compressions to restore circulation. Step 5. As soon as an AED is available, apply it and follow the prompts on the screen. Give 1 shock, then resume CPR, starting with chest compressions, for 2 more minutes before giving a second shock. If not trained in the use of an AED, a 911 or other emergency medical operator can guide you on its use. If no AED is available, follow the step below. Step 6. Continue CPR until there are signs of movement or medical personnel can take over.